Hey guys, welcome back to my channel. It's Amara here. If today is the first time you're tuning in, thanks so much for stopping by. Today I want us to look at a very rare medical condition, a medical emergency. It affects only the males. So if you have a male child, if you yourself, if you are a male or you are a daddy or a mommy, an aunt, an uncle, a friend to someone, please stay tuned and continue watching, and make sure you watch till the end. The topic that I want us to discuss is this: testicular torsion. Testicular torsion. I know that the topic sounds so hard to you. You know, medical terms sometimes when we give medical terms, if you're not a medical line, it sounds somehow, but I will try as much as possible to use a layman definition to help you to understand this topic. So what is testicular torsion? Testicular torsion is a medical emergency that occurs when the tissues holding the testicles are not strong enough, and when these tissues are not strong enough, it allows the testicles, also known as the testes, to rotate. It will cause the spermatic cord to do what? To twist, and when the spermatic cord twists, it will now affect the blood supply to the testes. You may be asking, which one is testicle, which one is spermatic cord? In the male reproductive system, we have the spermatic cord. The spermatic cord originates from the abdomen down to the testes. It's this spermatic cord that supplies blood to the testes. There is no other place that the testes gets blood supply from. And also inside this spermatic cord, we also have the vas deferens. It's inside it that the vas deferens now passes down to the urethra. So when there is twisting of this spermatic cord, I want you to take a look at this diagram. You see the first one is a normal spermatic cord. Then the other one is an abnormal one. The normal one is still straight, there is no twisting, whereas the one that is affected is now twisted. So for instance, to explain what I mean to us, let's say that this is the spermatic cord, and the spermatic cord is supplying blood to the testes. I will still show us here, but I want us to look at this. This thing is straight down. Let's say that water is passing through inside this tube now, and is passing to go and supply the testes. That is the normal. But if anything should occur, and instead of being straight, it will twist around itself, you see there will be shortage. It will block anything that is passing through it to the descending organ here. So when there is twisting of the spermatic cord, it will affect blood supply to the testes, and when this occurs, the individual will feel a sudden and a sharp pain. And where the testis is located inside the scrotum. The scrotum is that loose pouch of skin under the penis that you see under the penis. We call it the scrotum. So it's inside the scrotum that the testis is housed. So do you understand the definition, guys? Another thing now to look at is the symptoms to note. The symptoms, what are the symptoms that you see, and you see that this person is having testicular torsion? One of the first thing that they complain about, the first one is a sudden and a sharp pain felt at the scrotal area, or sometimes at the abdomen. This is one of the signs. The pain will be sudden, and it will be so severe and so discomforting for the affected individual. Then another second thing that you also need to look at, the second sign is, look out for if there is any change in the size of the two testes. So look at this. So check if there is any changes in the size of the scrotum. If there is any change in the size of the scrotum, that is, if one of the scrotum tends to be bigger than the other, then when the child is still complaining of pain, then it's an emergency. Then another thing is also check for if there is any inflammation. That is, if the place a kind of swelled up more than it used to be as the child is complaining of pain. Then another thing you also should check is if there's any change in color in the scrotum. You are the one that, if you cannot check it, you ask the person to check it so that you can seek immediate medical attention. Do you understand? Another symptom is that sometimes the affected person feel nauseous and a bit they want to vomit, and sometimes they'll be vomiting even when they are complaining of the pain. So if any of your loved ones complains of this, a male child, a young male, and an adult that feels sudden pain at the scrotal area or at the abdomen, you don't just need to treat it with any analgesic. Just take the person straight to the hospital for immediate medical attention. So when the person comes to the hospital, through examination and other things, it will be checked whether this is actually testicular torsion or not. Do you understand, guys? So you may ask me also, what of the incidence? How often does this occur? This is how it occurs, that this is a rare medical condition. It's a rare medical condition in the sense that it occurs in 1 in 400 males. So 1 in 400 males may be like, throughout my nursing career, this is my 11th year as a registered nurse. So throughout my nursing career, I think I have just seen 3 cases of testicular torsion. So you can imagine the difference in the years and the cases that I've seen compared to other medical conditions like hypertension, diabetes, and others. So this is a rare condition and it's not something that you see often, but you need to have the knowledge. Why do you need to have the knowledge? Because there have been cases that where it occurs in newborn babies that their parents are not even aware of what happened and will lose the testes. Then secondly, you need to know this because it's a medical emergency and you need to make sure that the patient or your child or whoever receive medical care within the first 6 hours of complaining that sudden pain in order to save the testes. So this will now lead us to the treatment. So what are the treatment options for testicular torsion? One of the major or the most common treatment option for testicular torsion is surgery, and the surgery is often carried out by a urologist after they must have assessed the patient and know that the patient has testicular torsion. And why do they do the surgery? Why won't it be a kind of relief with drugs, just like you may? Sometimes I've witnessed it. You give the patient a lot of drug, you give pain relief. As you are giving the pain relief, the pain will continue because you've not treated the cause of the pain. So when the patient goes into the theater, what happens is the urologist, when they open up, they will see whether it's just to untwist the spermatic cord. Sometimes the only thing that they need is just to untwist it. Then they will now use a kind of some sutures to hold the testes. If the tissues around it is loose, they will use some sutures to do what, to hold it so that it will not rotate freely like it used to, so that there will be no occurrence of this testicular torsion. Then another thing also is when there must have been necrosis or if there is atrophy of the affected testes, the only thing they can do is what? They will just remove the affected testes and cover the whole place up. So the patient will just be left with one testis. That is if medical care is not given on time. So with these treatment options, guys, you've seen that if you have any male child and the child complains of pain, your first line of action is not just to give pain relief. Please take the child to the hospital. It is better that you go to the hospital and they say that it's not testicular torsion and continue other management than you staying at home to do what? To treat the patient of what is not the problem. Do you understand? So it's also a medical emergency. You must have heard medical emergency from me almost throughout this particular video. The reason is that if somebody is having testicular torsion and for the first 6 hours you do not present that person to the hospital, the patient may do what? The patient may lose the testes if urgent care is not given, and if the person stays more than 6 to 9 hours before going to the hospital. Do you understand? Then in your mind now you'll be asking, what is it that can cause this testicular torsion? What can cause it so that I can prevent my child from getting it? The first thing I will have to tell us now is that sometimes they don't have any peculiar cause. Sometimes they will wake up feeling the pains. Sometimes it will be as a result of trauma. Sometimes the person will be walking and the pain will suddenly come, or they will just be gisting and the pain will suddenly come, so that you will not go and blame your child of doing something awkward. Because the first time we notice this, you are asking the person, what did you do? He said he just woke up and he was feeling it. He did not masturbate, he did not do anything. So it can occur on its own, and most times it is as a result of loose tissues within the testicles. So sometimes nothing predisposes it. The pain can wake the child up from sleep or anything. So I want you to get this now. And some people also have the tendency of having this testicular torsion if they inherited that loose tissue. So it's not all male. It's not because you are a male you have the risk of having testicular torsion. No, some people have a higher risk more than others if they inherited it in a condition known as Clapper deformity. So it depends on the condition. If it is an inherited trait, then you see that the person may have it in one of the episodes of his life, whereas some will not even have it. So I know you are now cleared that you played football and they hit you at the scrotum and you felt sudden pain. It may and it may not be. The only thing that will tell us whether it is or it is not is for you to do what? For you to present yourself to the hospital. Do you understand, guys? Then before I forget, guys, if you know you as a male that is watching this video or your child has been complaining of on and off pain at the scrotal area or the abdomen, it may be that maybe they will have torsion and the torsion will just go off and come in what is known as intermittent torsion. So if your child is often complaining of pain will come today, it will go the next day, please take that child to the hospital for urgent medical attention. Guys, I hope now you must have been cleared by this word that I'm talking about. So if you follow the diagram, you understand what I'm trying to talk about. And guys, don't forget to subscribe to this channel. If you want to be getting more updates, subscribe to my YouTube channel. Subscription is free of charge. So, and that will lead us to the final aspect of this video. The final aspect is frequently asked questions. The first time that I did this in the year 2018, so many people asked me questions and I want to answer it, but it will be in my YouTube channel. So if you watch this video up to this moment, thanks so much for stopping by. And to know the frequently asked questions, please go to my YouTube channel to go. One of the questions is I'm holding something here to read it out. Another one say, will my fertility be affected if I have this testicular torsion? Then another one asks me, can a newborn have testicular torsion? So these are the questions that people ask me, so I'm going to answer it in my YouTube channel. So it's not there now, so for you to know when I will put it, just click on in this page. You see where they say watch videos, click on that and go straight to the YouTube channel to watch other videos while you await when I will upload these frequently asked questions. And having said that, guys, thank you so much for watching, and don't forget to give me a thumb up, share this video if you get value, and don't also forget to tell your friends to like and follow my page.